At the outset, I would like to congratulate the Youthful IRSI for this initiative. I think it's a great initiative. It is very much required, and I think today's topic is very relevant because it is something that everybody is going to go through. That is a postgraduate exam. Once you're an ophthalmologist, you have no choice but to go through it. I would like to emphasize one thing, that there are milestones in life, just like you finish your 12th and that is stamped. You go to MBBS and that is stamped. You go to MDMS and that is stamped. You do a fellowship, that is stamped. But in life, actually, what you become is what you are much later. So wherever you are, whichever medical college is it, it's a peripheral college, it's a central college, it's the biggest college, it's the best college, it's not so good college. Do not feel anything bad about it because these are just milestones which you have to finish. So you have to get a degree. I'm not saying do badly. No, do your best, study hard, but don't feel, because in life what you are going to actually become is much what you are later in life. So it's not you are from some medical college which is there right in the periphery. That is not going to determine your destiny, or that is not going to determine your fate, because you are going to write your destiny and fate, and that is going to come much later. I'm sure all the people who are here will identify with what I'm saying.
Absolutely.
So I did. So we will now talk about post graduation exam preparation tips. Now, our post graduation exam just finished last week, and we had two toppers from there, and I've taken inputs from them because I thought that as an examiner, I can tell you what we want from you, but I will never be able to translate what happens on the other side. That can only happen when I talk to them and when I know their inputs, and when they want to portray what they want to tell you, they'll be able to help you in a much better way than I will be with my experience. So part of it is that, and then I'll also tell you as an examiner what we want from you and how to go about it. When I gave my postgraduate exam, and I'm sure Gaurav and others can also identify, I felt very cheated at the end of the day because we had studied so much, so much, so much. And then when the exam is over, you realize that only 10% of what you have actually studied is asked. 90% you know, but they've not asked you. So you think, why did you study so much? But for that 10%, you have to study everything, and not everything but important things. You don't have to know everything of everything. You have to know something of everything and everything of important things. The examiner is not interested in knowing what you don't know. The examiner wants to know what you know. And when they pass you or they fail you, they only think one thing: if this person goes outside and practices, is the patient going to become blind, or is the patient safe in his or her hand? So that is the only thing. So if you really do a blunder, they will, you know they will make you repeat. Otherwise they normally don't. That is not their intention when they start with the exam. Having said this, personally I feel that if you make a student sit in a supplementary exam and make him repeat an exam after 3 months or 6 months, it's going to change nothing. He's not going to get any better. So the best thing is that try and see what he knows and try and pass him on those points. And whatever, like I said, what you are going to become later, how you are going to treat, how you are going to examine, how you are going to operate is going to be what much later in life. Okay, so let me with this prelude start this topic. Okay, so how to go about an examination. So the preparation tips for a postgraduate examination. So postgraduate could be anybody, could be DNB, could be MD, could be MS ophthalmology, could be DO. There are several degrees in our part of the country. And there is a roadmap for theory exam. Now, I have come right to the theory. I'm not telling you that throughout your 3 years or 2 years, whatever your course is, you should be studying, because I know that whatever you may say, whatever you may do, it is only in the last 6 months that students, start to study. Either the workload is so much or they are not focused enough. So that study part actually takes a little backseat, or you are working up cases, then you are, trying to learn surgeries, then you are trying to learn investigations, or you are given too much of work of file filling, etc., etc. So that really doesn't happen. Although the best thing would be that whatever you case you see, you just go home and you read about that case, because that will remain in your memory forever. I mean, this is said easier rather than done. So I'm going to tell you how to prepare for the exam. So minimum 3 rounds of reading is what you should focus. The first round is 3 to 4 months. The second round is 1 month before your theory exam, and the third round is 1 week before the exam. Now, first you have to chalk out the syllabus, and I think in the first round, the most important thing is your previous year questions, because whatever you may say, they are going to repeat questions. Then point number two is frequently asked questions. Now, whenever we have exams for our final years, we have first years and second years, one or two, students always standing there, so that they know that when they're going to appear next time, what are they going to be asked. You should have a little bit of knowledge about recent advances and everything, because that is something that may be asked. Because what happens is that your own faculty or the examiners who are coming are also giving talks, and generally the talks are on recent advances, so they know about it already. So you have to know who, if you come to know who your examiner is, nothing like it, but you have to know what they would already know. So you have to know that. Then standard textbooks are there, so you gather, accumulate your study material. Then there are high yield PowerPoint presentations. Nowadays, there are so many webinars for postgraduates which are there, which you can always refer to. Then there are important review articles, and best is to ask your seniors, because then as happens in our institute, as soon as the exam is over, that very day, all the people who are, of the next batch will go to the to the batch who's passed the exam and gather all the material, because that is a ready-made material and they don't have to go hunting for it. And that material keeps on, getting added up and then keeps on getting passed. The best thing is, as soon as your exam going batch finishes the exam, you go and get the material that day only, because that day they are so excited, they'll give you the material. Afterwards, they will not, bother to find out the material for you and give it to you. So that day only you give the material. Then recent and hand down notes may be there, or self-made notes. That is also important, which you may have done over a period of 3 years. Then prioritize according to the weightage, according to the level of difficulty, and according to your own weak areas. Everybody knows what your weak areas are. Now, this is what the topper of our exam this year had prepared, and I told her that you just verbatim, you tell me how many days did you, need for each of these subjects. So she said this was the uh, first 3 to 4 months, anatomy and physiology, 7 days, refraction and optics, 7 days. All the old examiners will know this better than you, so you better know it. Then retina, uvea, cornea refractive 21 days. And another important thing is your retina and uvea also, because these are major things which are there. Cataract, you have yourself also done so much, and actually if you see in cataract, people don't ask much, and because you have a practical knowledge, so even if you have read less about it, you will still be able to, answer it. Then squint, I know, is difficult for everybody, 14 days. Then neuro-ophthalmology, I don't know about other colleges, but for us in RP Center, there's always a general ophthalmology case, which is a long case, and there's a neuro-ophthalmology case, or there is a medical retina case, which is a long case. Then glaucoma, again, about a couple of weeks. Then miscellaneous, small things, and recent advances, about 7 days. Now you've planned your thing well, and what happens if in the first round, 3 to 4 months, your syllabus is not getting over, which happens with everybody. There are very few people who will finish as per their deadline and as per the timetable. So it doesn't matter if you've missed out any topic in the first round, you cover it in the second round. And so when you start the second round for that particular topic, you start from that topic only which you have not covered. So don't miss deadlines. Don't extend beyond deadlines. I mean, don't say, okay, this was for 21st January, but it's not happening, so I'm extending it to, 15th February. So don't do like that. If it was for 21st January, whatever has happened, leave it. On 22nd January, start the second round and call it the second round with the topics you have not covered in the first round. So that is the way to go. Then you have to make a realistic schedule, and I think it is different for different people. Some people are early risers, so they like to study in the morning. Some are like to study in the night. So you know about yourself the best. When is your output the best? So whatever difficult topic it is, like for instance something like squint or something like neuro ophthalmology, you have to see the fields, etc. Try to put that in the time when your mind is most fresh, because it has to be high yielding, kind of a thing. So when you are very fresh, you do things which are more difficult, and when you are not so fresh, you do things which you can do even at the spinal level. Then whatever is left, you can use weekends to make up, because I know that when you are appearing for exams, say Monday to Friday, you still have duties to do, and you start increasing your hours per day gradually. It's difficult to start with 12-hour a day or a 16-hour a day schedule, so make it 2 hours a day, then increase to 3, then 4, like that. Now often it is asked, are classes helpful or not? I know that everybody likes to attend classes, or some people don't like to attend classes, but they do help because they tell you to filter out topics which are important. They give you knowledge about the topics which are important. They tell you what to stress, what is important, what will be asked, what is less important, what you can ignore. And if you have notes, or if you have PowerPoint presentations, or if you have those class notes, then they are very easy to revise. And of course, if you're doing one-to-one class, then you can also clarify doubts and you can reinforce difficult concepts. Now, I know it is very difficult. Generally, people don't prepare for the classes and go. But I know the topper of our batch this time. I'm also the postgraduate teaching in charge in RP Center. So I know that people who do well, they prepare for the class beforehand only, so that they know what to ask and they know what people are talking about. So for them, it is like a second revision. And when it is a second revision for them, then everything is retained very well, because you've read it, number one, you've heard it, number two, and then you'll read it again afterwards also, whenever you get time, but that remains in your memory as an imprint. Sorry. Then when you are on subsequent rounds of reading, it is best to revise what you have already read, rather than, trying to read a topic from a new book or a new article. So it is best just to re-revise whatever you have read, because that assimilates faster. Now, there's always a question, can we give exams during this period? And our students have done this. So best time to write exams like FICO, FRCS, FRC off. But then, you have to be focused. You have to target it like that. Okay, I will do this. I will pass my post-graduation, plus also keep this as my target, because the syllabus is more or less the same. Now, how do you do a theory exam? Preparation for the theory exam. Now, this is again from our toppers, this thing, and this book is, I think, Kansky. So whatever extra things are, you just keep pasting it on the sides or keep writing it on the sides. I don't know, you people must be studying from iPad, so you can keep putting it on the comments. And I know that there are a lot of new software also which help you to, end notes and put notes there and then only, rather than having to read the book. I know that most people don't like to read the book now, they like to read it from the iPad. So compile at one place, either on iPad or add pages in the primary textbook itself if you are reading from the book, so that when you are going round two, then you just have to refer to one document or your one resource, and you don't have to keep looking here and there. Then retrospective study, which is based on previous year's questions, like I told you, is very fruitful, at least 3 revisions. And then practice all the diagrams, because diagrams and theory exams are something that the examiner will see, because examiner also just, runs through your theory rather than reading each and every word of it. They just want to know what you know. So if you've made a good diagram, they know that you know, and even if they don't read whatever you've written there, you'll get good marks. And recent topics, hot topics like recent drugs, like recent lasers, like COVID-19 and ocular manifestations, these things you should know, because this is something that may be asked. Now, I think about the theory exam, it is like, like the way you used to do exam in schools by using gel or ink pens. Even these things even now make a difference. Put blue for the main text, black for the headings, blue for the main text, highlight important points, put boxed capital headings, use bullets, put flowcharts, put diagrams, put classifications. So all these kind of things which you used to do in school stand true even now, because they will, they tell the examiner what that all these things, and that is why these things have been highlighted. And the easier you will make for the examiner to read your answers, the more marks you are going to get. Then at the end of each answer, draw a line, because that means the question is over. And sometimes what happens is, if you don't draw a line and if there's no gap, then the examiner might miss giving you marks for a particular question, and might give you marks at the end of the 2 questions. Then you have to attempt all the questions. And if you're not able to recall anything, whatever you know about that topic, for example, it's a third nerve palsy, and you're not able to recall anything, whatever you know, you write third nerve palsy, etiology, or management, you write over there. And then make attractive headings like, clinical applications, latest research, surgical techniques. Now, preparation for your practical is a little different, because it can be in a group. Theory, I don't know, some people like to discuss. So each to himself or herself. If you like to discuss and read, it's fine. But case based studies are important. And then lay emphasis on points like age, gender predilection, risk factors, clinical features, presentation of the case, and rehearse in front of your group, so that is a rehearsal for answering in the viva. Then you have all this long case, short case, spot case, instrument, surgical viva, diagnostic investigations, and each of these you have to master separately because each of these has a weightage. It's not that you will only study for cases and then forget the rest, because you will be answered and you are given marks for everything. So you make a list of everything: pathology slides, microbiology slides, black box, etc. And it is best to study in small groups. If you have a very big group, then it becomes a crowd. And pay, like I said, importance to everything, whether it is refraction, retinoscopy, etc. Now, how to face the examiner on the day of the exam? So, of course, first you have to dress up very well. You have to look like a proper ophthalmologist. So, dress up in a formal way. Be polite. If you do not agree with the examiner on something, or you think the examiner is wrong, do not argue. Just give in, because MD or DO or MS is not, taken. It is given. So, it is given by the examiner. So, of course, dress tidily, that I have already said. Be confident and avoid beating around the bush. If you don't know, you just say, "I'm sorry, I am not, aware about this," or "I'm sorry, can you change the question?" So they will all change the question. Like I said earlier, they want to know what you know. They don't want to know what you don't know. Then do not keep quiet in front of the examiner. This I tell to everybody, to every batch which goes. I say that do not keep quiet in front of the examiner. If something is there, then whatever you know, or whatever you know about that disease, or whatever you know about that patient, just keep talking. Because if you keep quiet, then it is taken as a sign that it is taken as a sign of ignorance. So that should not happen. Then, of course, I don't know, these are optional, but it is best to carry your own things like, protractor, indirect ophthalmoscopy, direct ophthalmoscopy, measuring tape, plastic ruler, and put them in your pocket, color pencils, etc. Because it just shows that you are disciplined and you are anticipating things and you are prepared for it. Then whenever you say or answer, you say a complete diagnosis. If there's a NPDR case which is involving central diabetic macular edema with senile cataract, with locomatous optic atrophy, with nebulum macular corneal opacity, so don't miss out any finding. So this is going to be a complete diagnosis. Always, for every patient which we forget, is check for refractive error and even put that in the diagnosis in the end. If there's a hereditary condition, you have to ask for family history and again make a family tree. So a complete diagnosis and a complete workup. At least you may do or not do, but at least it should appear that you have done. Then Sharma test, breakup test, like for diabetics, you would never do, but it's important to do it because they can have dry eye. Then corneal sensations. Then then you should, whenever you are asked about anything, what is the cause of this, you should come up with the most common ones. Don't say the least common first. If you say the most common causes, the most common complications, even if you miss out the entire list, it's okay, it's acceptable. But if you miss out the most common thing, then that is something which is not acceptable. And of course, we've written books, but I wanted to talk to you about this book. This we had written in 2018, and this is primarily the work of Dr. Praful Maharana. So he, with the various postgraduates, had made a list of all the long cases, short cases, spot cases, and it's a reverse kind of a book. So you have a chapter, say, on corneal dystrophies, and then you read about it. But this is opposite. So it is like if you have a case of macular dystrophy, what five things in history you will ask, what six investigations you will do, and what will be the differential diagnosis, how you will arrive at a diagnosis. So it's a reverse kind of a book. So likewise for short and spot cases, and I'm sure the list can be longer. This gives only some representative long cases, short cases, and spot cases. And then we came out with the Ophthalmology Clinics Part 2, which had basic sciences, instruments, investigations, imaging, interpretation, and viva voce of the visual fields, OCT, etc. So these would be good to read, but these are not complete. So you have to make your own complete list of cases as well as what can be asked in the exam in the practicals. So thank you very much for your kind attention, and I would be happy to answer any questions that there are there.
Thank you so much, ma'am. This was especially helpful since I'm still in second year and soon to be exam going. And I'm sure we're going to incorporate these into our daily academics and it will be very helpful. Ma'am, Dr. Deepak Mishra, your thoughts on the matter?
First of all, I am the great fan of ma'am for all the things he has written, all the books. The book I like her most is on the corneal ulcer. I don't know how many people are doing cornea without reading that. Almost each and every corneal people and the young generation who have just completed their PGs in last 10 years must have read this book. And one thing important that ma'am has already shown, that making of timetable. It is very important to make a timetable for anything. Whether you are going for exam or any place, then making of a timetable is the key of the success from my point of vision. Wonderful talk, ma'am.
Thank you, sir. Dr. Naren Shetty, sir, what do you feel about this?
I think ma'am really lives by that example, the same slide which I was showing earlier, that, ma'am being in such a big position, still she's asking her students for help, in preparing. That's really, the way to go forward. She's leading by example. Really amazing, ma'am. I mean, truly, we really look up to you. And ma'am has covered it wonderfully. I mean, absolutely bang on. There's nothing else to add. I think in terms of preparation, I think only thing is I would suggest is do not panic. The panic is something that really we stop studying, stop doing everything. And the second thing is, please do not compare what the other, your colleague is reading or how much he finished. Please don't do that. That is the biggest mistake that you do. Just focus on you and yourself just before the exam, and just think you're going to do your best and come out.
Thank you, sir. Introducing our next panelist, Dr. Deepak Mishra. He's an associate professor at Banaras Hindu University, Varanasi. He's the chairman of UPSO's scientific committee. He's also the chairman of SSTC AIOS. He's the author of many national and international books and is the board member for 11 national and international medical journals. It's a pleasure having you on board, sir.
I'll just say a few words before Dr. Deepak starts. Ma'am, it was wonderful. I got goosebumps as if I was appearing for my MS exams. It was absolutely, the adrenaline flow was like that, to know exactly what and how to prepare. Brilliant. I think every slide of what she has said, if the postgrads work on each of these slides, they can get 60% mark first of all by even understanding the slides. And then you can just decorate after that to get your gold medal. But this is the bare minimum. Seriously, simple thing which she said, and every slide should be gone through meticulously and put it in practice. Because if you live day to day, because like classical Viva exam, the best part of the Viva exam is how well you can talk yourself into not telling the examiner what you don't know, but exactly walking him into what you know. You have to hint, you have to pause, and you have to let him guide him to ask him what you want him to ask him. And that is something, how well you can guide the Viva voce. This is what will happen in life also. Because the Viva exam is so mandatory, because every patient you see in your life, in day-to-day practice, is actually a Viva going on. While talking of a multifocal, or you're talking about a detachment and you're not sure, if you stutter a little bit, the patient will make out that you failed your exam. And this is true. These are all steps to understand, and this will go a long way in day-to-day practice also, to go and understand how to give your exams. Every single day in medical practice, you're undergoing exam. One in the operation theatre and one in the OPD. And that is how it is. Thanks, ma'am. Thanks for sparing your time. Always. It's so beautiful to listen to you.
I think Namrata did a fantastic job. This is going to be recorded and saved for posterity, to listen to this, talk that Namrata you gave today. I really enjoyed listening to each and every bit, and how scientifically you've analyzed the whole thing. And, every PG should probably, take a copy of this and listen to how to prepare. It'll really take them a long way and make life so easy for them. I think what an amazing job you did, Namrata. I enjoyed every bit of it.
I know it can be better, and I would like to thank Dr. Ayushi Sinha and Dr. Ananya Goswami, whose inputs I took. And I knew that I can tell them what examiners want, but I knew that I can't ever tell them from the student's point of view, because the generation is entirely different. So that's why I talked to the exam going batch, and from them I took the inputs.